Ideally, we want to provide patients with an opportunity to have at the least amount of interruption in their life. The benefit to the Ren wearable is the fact that it is a non-pharmacologic option. Over and over and over again, I see patients who tell me, I don't want to take a medication. I'm not comfortable with a medication. So when I can actually show that I've heard them by offering them something that isn't a medication, that's a win-win. That says that I'm understanding where they're coming from, what's important to them, while also offering something that has real tangible benefits. The Ren wearable has helped me personalize care for patients in adding something for them that can be layered right into their treatment plan. They have a treatment option that they're in control of. They have no systemic side effects, no drug-drug interactions, and no sedation, so it's a win-win. It also affords them the opportunity to take a treatment and continue to work or continue to go to school or continue to parent or function. We know that when patients aren't treated aggressively early on, there's a higher risk for patients to have more refractory treatment. So in other words, it's harder to treat if you wait. The Ren wearable is FDA cleared to treat migraine with or without aura. It works on the nerve fibers in the arm to help your brain initiate its own pain-fighting capabilities. Traditional medications for migraine, whether it be over-the-counter or prescription, they have a lot of shortcomings. Most of the older medications, at least, have sedation as a side effect. So the Ren wearable exceeds in that arena because it doesn't have that sedation. Remember, the reason we're trying to treat migraine in the first place is to help somebody's quality of life improve. And so if you're going to prescribe a medication that's going to make them too tired to function, that really goes against what we're trying to do here. My advice to prescribers who see patients that come in with headache, maybe not confident in making the diagnosis, maybe not comfortable prescribing the rescue medications or even the preventatives, to give the Ren wearable a try. If you suspect migraine, to go ahead, make that diagnosis, get the Ren wearable for the patients at the very least, because you're not going to cause a systemic side effect. And the studies are clear that this is an effective treatment, sometimes better than the medications that are offered to patients. And so I would say to people who are hesitant, prescribing the Ren wearable is easy. You send the prescription, the specialty pharmacy contacts the patient and mails it directly to their home, and then they can start using it that day. There's great data that show that there's pain freedom with the use of this device.